name is Laurie. I'm 48 years old. I am a nurse practitioner by training, and I would say that I have been suffering from depression in one form or another since my early to my mid-20s. I was in graduate school getting my nurse practitioner degree when I was sitting in a lecture, just kind of a basic mental health lecture, and kind of reviewing the steps of dysthymia and depression. And I just remember sitting in this huge lecture hall and just staring at the slide like, that's me. Oh my God, that's me. That's what's wrong with me. Medications didn't work well at all for me. I have been on multiple combinations of many different kinds of medications, tweaking dosages up, down, all around, and new combinations of different medicines, trying to having the doctor try and think, what haven't I tried you on, what could we possibly use, and I've never really had a favorable result to medications. Things that should bring you the little things in life that should bring you joy, I couldn't. As I began to feel more and more and more hopeless that there was ever going to be anything that would pull me out of my depression, and I started to worry that I was looking at the remainder of my life, essentially, to be some form or another of depression. And the hopelessness that came with that made me think, what options do I have? There comes a point in time when too much of your life has already passed you by. Come sit with me. This is my husband, Michael. We've been together for 6.5 years.
Laurie was in a very bad state, very bad state. She was sleeping a lot. She was crying a lot. She was indicating how depressed she was. She was on medication, and she, like I, was having her medication tweaked from time to time. And I felt, prior to going to that office visit with that psychiatrist, that what he was going to do was tweak again. And I'm a rather aggressive guy, and so I don't have any qualms about speaking my mind. And sure enough, his answer was, well, let's bump up your Wellbutrin by whatever. And I looked at him and I said, we keep going through this. And so before that appointment, I had spoken with Laurie and I had said, look, if he says I'm going to tweak again, then I'm going to let him know that that is not a satisfactory solution. So sure enough, he said, I'm going to tweak. And I said, doctor, with all due respect, and I said the words like that, we have been going through this. Laurie is on the verge of hospitalization. She's not, she's very unhappy. She can't even, she's not even mobile. And please, let's find another solution. Initially, he became angry, I believe, because I spoke my mind. And then he left the office. He just got up out of his chair and he left the office. And my initial feeling was, oh my God, he's so mad at me for saying this. But what he was actually doing was calling a TMS psychiatrist and trying to get Laurie to see a TMS psychiatrist. So then he walked back in the room and he said, I know someone who has a therapy called TMS. I think you might be a suitable candidate for TMS. And then we came to see the psychiatrist who offered TMS, and Laurie was then evaluated and then subsequently went into TMS. And Laurie was so bad off that I believe she wanted to start the TMS that day. You know, she said, I don't want to wait anymore. You know, she was desperate. And I know what that desperation feels like. On her initial consultation, I was very skeptical, very skeptical. And I even told Laurie, well, why don't we wait a little bit? And, you know, we're not in such a rush. And Laurie says, you know, I want to start now, you know. And, you know, I knew Laurie would have to raid her retirement account, and I wasn't in favor of that. But like I have been, I knew Laurie's desperation. I believe it was about 20 to 23 sessions where she said that she couldn't believe how she felt, that she felt great, and I noticed her sleep went back to normal. I've seen an incredible change in Laurie, and Laurie, her attitude toward life, her getting up earlier, she still enjoys her sleep. I knew that from pretty much within a week or two of meeting her.
It's the best. I don't think there's anybody in my family or my friends that would disagree that it's probably the best money that I've ever spent.
The TMS has been very worth it for me because we can ask the question, what's it worth to be dead or alive? And I'm alive now. And being dead is horrible.
Medicine is always changing. We're always learning new things. We're always, advancing, and only by kind of broadening our horizons do we know what else is out there that could be helpful to patients. And I'm sure that there are many psychiatrists in the community that have, difficult patients like me that are not responding to therapies, to psychotherapies, to medications, to whatever. And why anyone would want to limit their practice to not include a relatively new therapy that has been shown to be effective. I just think that really is not doing yourself or your patients the service that you should.